How does colchicine work to treat gout? Imagine a tiny molecule that can help calm down a fiery joint attack. That's what colchicine does for people with gout. It's been used for centuries, but modern science has shown exactly how it helps reduce inflammation and pain. At the heart of colchicine's action is its ability to interfere with microtubules inside cells. Microtubules are like tiny scaffolding that help cells move and do their jobs. Colchicine binds to a protein called tubulin, which is the building block of these microtubules. When colchicine attaches to tubulin, it stops these structures from forming. This might sound simple, but it has big effects on how immune cells behave during a gout attack. When uric acid crystals form in a joint, they activate immune cells like neutrophils and macrophages. These cells rush to the joint to fight what they see as an invader. Normally, they move quickly by using their microtubules to navigate through tissues. But colchicine prevents microtubule formation, so these immune cells can't move as easily. Fewer immune cells reach the joint, which means less swelling, less pain, and less tissue damage. Another key way colchicine works involves the inflammasome, specifically the NLRP3 inflammasome. This is a complex inside immune cells that gets activated by uric acid crystals. When it activates, it produces a chemical called interleukin-1 beta, which is a major driver of inflammation and pain in gout. Colchicine inhibits the activation of this inflammasome, so less interleukin-1 beta is released. This helps to dampen the inflammatory response and reduce the severity of the attack. Colchicine also has other anti-inflammatory effects. It reduces the production of harmful molecules called superoxide anions, prevents immune cells from releasing inflammatory chemicals, and stops the attraction of more immune cells to the joint. All these actions work together to calm down the inflammation caused by uric acid crystals. It's important to note that colchicine does not lower uric acid levels or dissolve the crystals themselves. It's purely an anti-inflammatory medication. It helps control the body's response to the crystals that are already there, making symptoms more manageable. For acute gout attacks, colchicine is most effective when taken early. Usually, a dose of 1.2 milligrams at the first sign of pain, followed by 0.6 milligrams an hour later, can significantly reduce symptoms if started promptly. It's important to follow medical advice because taking too much can cause side effects, and the difference between a helpful dose and a harmful one is small. In long-term management, colchicine is often used as a preventive measure. When starting medications that lower uric acid, like allopurinol, some people experience more gout attacks initially. Taking colchicine during this period, often for at least 6 months, can prevent these flares. For those who cannot tolerate other medications, low-dose colchicine daily can also help prevent attacks and improve quality of life. Because colchicine works on cellular processes, it has a narrow therapeutic window. Proper dosing and medical supervision are essential to avoid toxicity. When used correctly, colchicine remains a safe and effective tool for managing both acute attacks and long-term prevention of gout. Understanding how colchicine works highlights why it's been a mainstay in gout treatment for so long. It targets the inflammation at the cellular level, helping people live more comfortably with their condition. Always remember to consult your healthcare provider for personalized advice and proper management strategies.